Hello, my name is Nick, and I will be doing a physical assessment on this stuffed animal. So before I begin, we checked the vital signs of the patient and there were no abnormal values. Everything was in range. And the patient's visual examination was performed on a Snellen chart, and the patient scored a 20 out of 20, meaning that the patient could read every letter on the 20 out of 20 line and could not read all of the letters on the line below that. So now I will begin. Knock, knock. Hand sanitization per CDC guidelines. Hello, my name is Nick and I will be your nurse today. Can I start by having your full name and date of birth? Okay, do you have any allergies? Any allergies to the food or drugs or the environment? No, okay. So can you tell me why you are here? Can you tell me where you are? Can you tell me the time? And can you tell me the President of the United States? Okay, so what kind of mood did you wake up in today? Happy? Okay, do you usually wake up happy? Yes, great. So do you have any pain today? No pain? Great. So I'm going to be asking you about your bowel movements. Have you had any, when was the last bowel movement you had? This morning? Okay, and what was the color and the consistency? All right, and how frequent do you urinate? All right, and is the color, what is the color? Okay, and the odor? Is there any weird odor? No? Okay. Do you have any burning or tingling sensations, any itching or pain associated with your urination? No? Great. So before I begin, I'm going to have to touch you. Do I have consent to do so? Yes? Okay, so I'm going to begin by using the pen light to examine your ears. So I'm going to pull the auricle upwards and outwards and inspect inside the ear. Pen light on. Okay, the ear canal, outer ear canal is free of any drainage. The ear canal inside is pink and there's minimal cerament present. Pen light on. The inner ear canal, the ear canal is pink. Outer ear is free of drainage and there is minimal cerament. Okay, so I touched my face, so I'm going to sanitize. All right, so while I'm here, I'm going to do the whisper test. I'm going to whisper behind the patient a word and he's going to repeat it. Red, red, blue, blue. Okay, very good. Now I'm going to assess the eyes. So I'm going to first check pupillary response reaction. Pen light on. Pupil constriction. Pen light on. Pupillary restriction. Actually, we're going to do it with the hand over. Pen light on, pupillary restriction. Pen light on, pupillary restriction. Now I'm going to check consensual pupillary response. Okay, pen light on. Restriction, constriction, pen light on, constriction. Okay, now I'm going to stand 12 to 18 inches in front of the patient and ask them to follow the pen. Okay, now go ahead and keep your eye on the pen as I bring it close to you. Okay, pupils equally round, reactive to light, and accommodate. Now I'm going to check the nose to see if there's any drainage, deviated septum, no. Okay, I'm going to do a olfactory smell test. Okay, can you smell this? Yes, it smells like aloe vera lotion. Good, okay. Now I'm going to check inside the mouth, but before I do that, can you smile for me, please? Okay, patient smiled. And can you stick out your tongue and move it side to side and up and down? Okay, good. And can you shrug your shoulders, please? Okay. Now open your mouth, please, and stick up your tongue. Okay, frenulum, pen light on. Frenulum is midline. Oral mucosa is pink and moist. Patient has tonsils +1 and no lesions, masses, or any abnormalities inside of the mouth. Okay, now while I'm here, I'm going to ask you to turn to the right, please, to assess for JVD. Pen light on. No JVD, less than 3 centimeters. Okay, now turn to the left. All right, pen light on. No JVD, 3 centimeters. All right. I'm going to assess, sanitize hands. Now I'm going to assess your lymph nodes. We're going to do the pre-auricular, post-auricular, occipital, retropharyngeal, submaxillary, submental. On and behind the SCM are going to be the cervical chain, and then the supraclavicular by hooking my fingers here. So none of them were palpable, no swelling. Okay, now I'm going to move on to the arms. First, we're going to inspect the arms, free of any masses, lesions, scars, any skin abnormalities. Skin is intact. Okay, so I'm going to palpate for edema along bony prominences, no edema present. I'm going to assess for temperature. I'm going to assess under the clavicle for skin turgor. Skin is elastic. Okay, now I'm going to ask the patient to squeeze my fingers, bilateral strength. Okay, I'm going to check the bilateral radial pulses. Okay, symmetrical. Check capillary refill, less than 3 seconds, less than 3 seconds. Okay, now I'm going to check range of motion. I'm going to ask the patient to put their hands by their side and go over the head. Okay, did that hurt? No? All right, now go ahead and stretch your arms out and flex your forearms towards your head. Okay, no pain associated with that, great. Okay, so now I'm going to check your reflexes using my reflex hammer. Sanitize. Okay, I'm going to put my thumb into the antecubital region, and I'm going to strike the brachioradialis tendon and watch for forearm flexion. Okay, finger in the antecubital region, hit the brachioradialis tendon and see flexion. Okay, now while I'm using the hammer, I'm going to ask the patient to sit and dangle their legs over the edge, and I'm going to check for the patellar tendon reflex. I'm going to strike the hammer below the kneecap on the patellar tendon, and we see flexion. Okay, or extension rather. So put the hammer back, and now I'm going to grab my stethoscope for auscultation. Sanitize hands. Okay, I'm going to auscultate in between the trachea and the SCM. Tell the patient to hold their breath for 15 seconds. Assess for any carotid bruits, no bruits present. Palpate carotid artery, +2, palpable. And now I'm going to check for symmetry between the radial pulse and the carotid. Okay, the pulses are symmetric. Now I'm going to assess the heart. Using the diaphragm, I'm going to check the second intercostal space, right sternal border for the aortic, where S2 is louder than S1. Okay, now I'm going to check the pulmonic valve at the second intercostal space, left sternal border, where S2 is louder than S1 again. Then I'm going to use the bell to check at Erb's point, third intercostal space, left sternal border, where the S2 is equal to S1. I'm going to use diaphragm to check the left sternal border at intercostal space 4 at the tricuspid, where the S1 is louder than S2. Then I'm going to check the mitral valve, where S1 is louder than S2 at the 5th intercostal space, left midclavicular line. Okay, and after doing this, I'm going to assess for respiratory sounds. Bear, I'm going to ask you when the stethoscope diaphragm touches your body, just to take a deep breath for me, please. Okay, clear, 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 clear. Okay, all breath sounds are clear. Now on the right side, I'm going to ask him to move his arm up, and I'm going to check the mid-axillary line, 4th to 6th intercostal space. Take a deep breath. Breath sounds clear. Okay, now on the back side, we're going to ask the patient to take a deep breath, do the same thing. Okay, avoiding the scapula. Clear, 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 and clear. Okay, Bear, can you take a deep breath for me to check respiratory expansion? Okay, symmetrical. And the back is free of any scars, lesion, skin is intact, and the front skin is also intact. So now I'm going to wash my stethoscope and I'm going to inspect the abdomen. The abdomen is free of any lesions, so the patient's going to lie supine. I'm going to check if the stomach is slightly rounded. Okay, now I'm going to assess for abdominal sounds. So first we're going to check the right lower quadrant for 15 seconds, right upper quadrant for 15 seconds, left upper quadrant for 15 seconds, and left lower quadrant for 15 seconds. We heard about 16 to 20 gurgles per minute. And now we are going to percuss, tympani, 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 and tympani. Okay, so now I'm going to palpate, and but before I palpate though, I'm going to auscultate for bruits along the left of the midline with the bell for 15 seconds. Okay, no bruise. Now I'm going to palpate, and if you have any pain, just let me know. No pain, no pain, no pain, no pain. So there is no rebound tenderness for the patient. Okay, go ahead and sit back up. Now we're going to move on to your legs. Okay, so to begin, I'm going to ask you to sit still, and I will palpate along bony prominences for edema. No edema. Inspecting the skin. Skin is intact. No lesions, masses, scars, any bruising. Okay, so we did that. Now I'm going to check your popliteal pulse for symmetry. Yes, and put dorsalis pedis pulse for symmetry. Okay. I'm going to check capillary refill. Less than 3 seconds. Less than 3 seconds. Okay, now I'm going to check for strength. Go ahead and pull when I push. Okay, now push when I pull. Okay, bilateral strength is equal. Now I'm going to ask you to bring your knee up to your chest. Check for range of motion. Good. Left side. Okay, now go ahead and dangle your ankles and wiggle them for me. Okay, wiggle the ankles. Wiggle the ankles. Good. So that completes the assessment of the legs. Now I'm going to ask you to stand up. Put your arms by your side. Close your eyes and stand still for 20 to 30 seconds while I perform a Romberg test to assess for your balance. Okay, patient is balanced. Now go ahead and walk 5 feet for me. Okay, now walk 5 feet backwards. Gait and balance is normal and proficient. Now I'm going to check your cerebellar responses. Your upper one first. We'll ask you to go ahead and pat your repeating motion like that on your thigh. Okay, good. And now go ahead and use your heel to move up your shin towards your knee. Nice. Okay, so thank you, patient. That completes your assessment. Bye.